want to talk about colon cancer screening. Multiple ways that we can do that. The preferred method has been colonoscopy because it's the best at finding precancerous and cancerous lesions in the colon, and it's also one-stop shopping. That is, if you find polyps or cancers, you can biopsy or remove those right at the same visit. What I always tell patients is you have to think about colon cancer as the end of a spectrum of disease. So most colon cancers don't just start as a colon cancer. It's the end of a long process whereby normal tissue turns into a small polyp, which turns into a bigger polyp, and then ultimately can transform into a colon cancer. The only good news about that is that this long transitional segment, which can be 10 to 15 years, gives us a chance to go in and remove those polyps and interrupt that process. For most folks that are at average risk, you want to start screening for colon cancer at about age 50. Normal or average risk means nobody who's a first degree relative, mom, dad, brother, sister, had colon cancer or advanced colon polyps. For those folks, getting a colonoscopy when you're age 50 helps you decide, hey, do I have colon polyps and I have to worry about this, in which case we take those polyps out and follow those patients more closely, or do I not have any polyps, in which case you're good for 10 years and go live your life and we'll take another look. What we know is that colon cancer is common. About 150,000 new cases are diagnosed in the United States every year, and it's the second leading cause of cancer death. So anything that we can do to prevent or reduce those numbers, I think, is important. The group that we didn't talk about is the folks who are at increased risk, that have a family history or personal history of colon cancer or advanced polyp disease. Those recommendations are a little more individualized, so I encourage folks to talk to their doctor about what kind of screening I should do and when it should be done, because that's more individualized. But